Okay, let's go.
If you're concerned about prediabetics and how to prevent it from progressing to diabetics, you are in the right place. You're going to learn everything you need to know to take control of your health. Prediabetics is an intermediate stage between normal blood glucose regulation and diabetics. Approximately 1 in 3 adults are dealing with prediabetics, and 720 million individuals are affected worldwide. You can see it's a condition that is rampaging the world. And if you don't do anything about prediabetics, you can progress to diabetics. And as crazy as it might sound, a lot of people that are dealing with prediabetics don't even know about it because they've not started dealing with signs and symptoms, because it's not everybody that will present with signs and symptoms. This is where I put it to you that you need to do checkups, at least monthly checkups, 6-month checkups, or yearly checkups to know where you stand in your sugar level monitoring. Prediabetes is defined by a fasting blood glucose level of 100 to 125 milligram per day and glycated hemoglobin level, that is HbA1c, of 5.7 to 6.4%. A lot of people don't know their values, they don't know their ranges, they have been living their life. Approximately 10% of individuals with prediabetics can progress to diabetics on a yearly basis, but if you don't do anything about it. Remember, this video is about how can you stop this prediabetes to progressing to diabetics. So it's time for you to take charge of your health. We have several risk factors, that is predisposing factors, that what if I'm having this, it can predispose me to having prediabetics. Number one risk factor is when there is family history. Your parents, your siblings, uncles, is there something like that? Secondly is age. Between ages of 45 and above are at greater risk. Thirdly is living a sedentary lifestyle. How physically active are you? Fourthly is your weight, your body mass index. Are you overweight? Do you think you need to lose weight? Especially weight packed around your waist region. There are several complications that can come with pre-diabetics. Even though you have not progressed to diabetics, those complications can come. Number one is cardiovascular diseases. That is high blood pressure, stroke, dyslipidemia. When we talk about dyslipidemia, we're referring to when you have abnormal levels of your lipid profile. That means the body is struggling to actually metabolize the fats in your system, the lipids in your system. This can reflect in your lipid profile being high, especially your triglyceride, your low density lipoprotein, your total cholesterol, and even the very low density lipoprotein. You don't get to have normal levels of high density lipoprotein. What happens is that this dyslipidemia can cause fat depositions in your blood vessels, and when this happens, there could be microvascular diseases, microvascular dysfunction, or macrovascular dysfunction, where the arteries are clogged and where the capillaries, the veins, that is the micro, they are clogged and they are damaged. So nerve damage could be there, eye damage, that is retinopathy, it could be there, kidney damage could come up, foot problems. So this is why it's important you stop that progression. You don't want it to progress. So let's look into 5 actionable practical tips you can start doing today that will make all the difference in your health. Number one, let's settle this. Studies have proven that lifestyle intervention remains your best option, even gives greater results more than metformin when it comes to reversing pre-diabetics to diabetics. That is, if you really want something that is sustainable, you don't just want something that is a quickie and that's it. With metformin, you can deprive yourself of vital nutrients like the B vitamins that indeed all your system needs to work with. And at a time, you can actually damage beta pancreatic cells that helps in insulin regulation. So the number one tip here is you're going to be involved in healthy eating. We can't say this enough because many people don't seem to be hearing us. So we need to loud it so that people at the back can get the memo. Healthy eating. Focus more on proteinous food, foods that are rich in healthy fats, foods that are very low in their glycemic index. I made a video talking about this food. Maybe I will link it up in this video so you can know where to start from. Secondly, you need to stop snacking. Quit snacking. If you must snack on almond nuts. There is unsweetened yogurt. Yes, you can eat cucumber. Cucumber has been proven to help with dyslipidemia, cleanse your liver so that yes, the insulin can work better, open up the clogged arteries. That is it. Second lifestyle intervention that you need to get serious with is your exercise routine. This time around, we're looking at least make sure you're having 45 minutes exercise on a daily basis. This time around, it has to be exercise tilted towards being intensity. If you're already having blood pressure, that is high blood pressure, you might stick to moderate intensity exercise like weightlifting. If you must do cycling, make sure you break a sweat. Even jogging can help a lot. My emphasis is make sure you are sweating out. You are sweating out. That way you're opening up your blood vessels. You are cleansing your whole system, helping the liver, helping the kidney, helping your heart, and again improving your insulin so that the glucose can gain access into the cells and be used up. Next is weight management. Losing, even if it's 5 kg, 7 kg, 10 kg, can significantly improve your risk factor and even prevent you from developing diabetes. So you want to make sure you are losing that weight. One effective way you can lose weight is by doing intermittent fasting. I keep hammering it. For you to derive therapeutic effects that comes with intermittent fasting, you want to make sure you are fasting at least 12 hours upwards. Stay hydrated. Staying hydrated is very, very efficient in helping your kidney, in helping the liver, in helping your overall body system to detoxify. Next is quit smoking. If you're someone that is a chronic smoker or you just smoke, you need to quit smoking. You can seek help on how to actually quit smoking if it's becoming so difficult for you to do, because it is a proven risk factor that people that smoke have higher risk of developing prediabetes and diabetics. Next is regular checkup. As you are in this journey, make sure you keep your numbers known to yourself. Even if it's on a 3-month basis, on a monthly basis, some persons can even do on a daily basis, depending on how severe you are having these symptoms. Because there are several symptoms that could come with prediabetics. Number one is irritability. Food problems like tingling sensation, difficulty sleeping, infertility, struggling to ovulate, struggling to have quality sperm count, struggling with erection, struggling to get a woman pregnant. Sometimes that woman gets pregnant, she will struggle to have that baby to stay to full term because gestational diabetes can set in and cause stillbirth or even miscarriage. Sometimes there could be fatigue, sometimes there could be blurry vision, sometimes there could be skin tags, sometimes there could be digestive issues because you are lacking those essential vitamins that regulate your sugar level. Your body is lacking in it. So I believe that with these practical tips, you are equipped to start taking action today. One amazing thing about prediabetes is that it can be reversed. It can be reversed, and it really starts from you taking a decision to say enough is enough. I'm having my life back. I'm reversing these numbers. I'm bringing down this fasting blood glucose level. I'm bringing down this my HbA1c values to the optimal level where I want to see it. Monitor your progress. If you're already dealing with symptoms, one way you can actually know if you're getting back in shape is by checking how your symptoms are faring. Are they getting worse or are they reducing? You need to know that it's a journey. It's not a quickie, it's a journey. So make up your mind to go on this journey because you want to live a healthy life. Try to your name from the millions of people that usually progress to diabetics worldwide. He wish above all things that you and I prosper and be in good health, even as our soul prospereth. For more videos like this, subscribe and hit the icon notification button so that you will be updated once I upload videos on this. The only problem I will have with you is that if you're not implementing, be a very fast implementer. Once you get these tips, get to work, start implementing. This is where the magic lies, because the little steps that make the magic transformation you are looking for. Stay blessed, stay healthy. Thank you for tuning in today.